Hello, everyone. I want to take some time to address small business owners whose revenue has been drastically reduced, as well as those who may have been laid off and are either losing health insurance or can no longer afford it. I don't normally discuss individual health insurance because the only two companies that offer major medical health insurance in Western Pennsylvania made the decision a while ago not to pay agents or agencies commissions for applications submitted outside of the 45-day window that is the Affordable Care Act annual election period. Other than this annual election period, only those who lose their health insurance due to circumstances like retirement, a layoff, resignation, or termination can get a health plan outside of those 45 days. So unfortunately, agents aren't compensated to advise people and facilitate enrollments when that doesn't occur between November 1st and December 15th. So due to this and the fact that ACA enrollment period runs the same times as Medicare's, we made the decision a couple years ago to get out of the individual health insurance business with just a few exceptions. However, I understand there's going to be a large number of people who already are or going to find themselves in some tough financial situations. So therefore, the health insurance store is immediately going to help and counsel anyone who's lost their job, had their business shut down, or had their income drastically reduced. We understand, those people with restaurants and bars are just doing takeout and, they no longer can sell booze. And for most people, that's a huge part of their income. Construction people have been shut down or limited. So we get it. And we want to make sure that we let everybody know that we are here to help those people who find themselves in this situation. So let's start to discuss small business owners first. So some of you may already have an ACA plan or what's known as Obamacare. So if enrollment was done through the marketplace, there's a couple of options that you have here. Number one, you can amend your application with lower estimated income for the year. So by doing this, you can lower your premiums and also your deductibles and co-pays as well. So this is something most people don't know. We can go in there anytime and make these changes and get some relief for you premium-wise. Again, the ACA and Obamacare, whatever you want to call it, it's really, really confusing. And if you don't understand the ins and outs of it, it's really easy to make a mistake. So again, we can help you with that. The other option, which I think everybody should do if they can, is to file for Medicare assistance, medical assistance, which is also known as Medicaid. And many people don't realize this, but when it comes to those under 65 years old, your assets aren't considered when determining eligibility. So for example, if you owned a restaurant, a building and the property it sits on, but your income now today falls under 138% of the federal poverty level, you qualify. You could even have savings accounts, investments, an IRA, and you qualify for medical assistance. There's only one exception to the asset rule, and that's those who are collecting Social Security income now, and that would only be people that are 62 or older, or people who are on disability. And for those people, the asset limit is very low. But again, we're only talking about people 62 and older, 62 to 65, that are already collecting Social Security. And most of those people aren't working anyway. So again, we're not going to have much of an issue with that. So here's another fact regarding medical assistance, Medicaid, that most people don't understand either. It's the income you earned last month or last year has no bearing on your qualification today. So only what you're making at the time you apply is generally considered. So we've already made calls to the state to research just how those who are self-employed and made a profit in past years are now going to prove they have little or no revenue stream. But per our conversations, it appears that the state is going to be, somewhat lenient in this regard, and to prove income or actually lack thereof, those who are self-employed can just use a monthly ledger showing revenues compared to what their expenditures are. So if you needed to go back, if you're like me and don't normally do that, you just reconcile it at the end of the year. You could go back to January and just write a monthly statement. We had these expenses for January, February, and March. We had these expenses for each month. And if it shows that, again, you're not making much money or even losing money, which I'm sure a lot of people are, that's it. You qualify. You'll just need to make a statement as well that you're either no longer working, no longer open, or have been limited in your capacity to do business due to COVID-19. So we recommend applying for medical assistance online, and that website is Compass, compass.state.pa.us. Again, that's compass.state.pa.us. And at the end of the application, there's a section for additional comments where that statement can be provided, okay? So those in this situation who aren't sure if they qualify, you're welcome to call one of our offices. reach out via our website. The phone number at the office that we have staffed, the best right now is 724-603-3403. That's 724-603-3403. Our website is getyourbestplan.com. 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 And it's my opinion anyone in this situation is wise to temporarily go on medical assistance if found eligible. So first, because Medicaid costs nothing and there's no out-of-pocket cost except for really low copays for prescription drugs. I think the highest is like $9. And then also when things get back to normal and you no longer need it, you can, again, roll in an ACA plan at that time. So that's another what's called special election period, that if you lost medical assistance because you went back to work, income starts to come in, we can go back into the marketplace and apply. Now, those of you who have group employer plans, you're getting a plan through UPMC or Highmark, you can do this too if you need to. I mean, if you can't afford these premiums, we can drop that. We can go on medical assistance. And then once everything gets back to normal, let's go ahead and get you back on a group plan. So now, this will not be as cut and dry for those people who've been laid off. So unless your household income, which includes unemployment, by the way, is less than 138% of the federal poverty level, you won't qualify for MA. For once, people who are self-employed are going to have a little bit easier time than those who aren't. But anyways, in this case, Affordable Care Act, aka Obama plans, and COBRA are the safest choices, and our agents can help determine which one makes more sense for you. So if you just call, if you research, okay, what does COBRA cost per month, and you call us with that information, with your deductibles and so on, we can go in and get you a quote through Obamacare, through the Affordable Care Act, the federal marketplace, and see which one is most cost effective for you and help you apply. Here's where everybody needs to be careful. This is a warning to people. There are alternatives to major medical health plans such as indemnity plans or Medicare Share, which are also known faith-based plans. They're advertised as lower cost alternatives to the ACA or Obamacare. Buyer beware. Again, these are not major medical health plans. The only two companies that offer major medical health plans in Western Pennsylvania are Highmark and UPMC. So if somebody is pitching you a plan that is not Highmark or UPMC, they are pitching you a plan that is not major medical, does not work like insurance you've had historically through the marketplace or through your insurance or through your employer. So we're not comfortable selling these, and we don't sell them because they have no maximum out-of-pocket limit, which caps what one could be billed in a calendar year. In other words, most plans, the plan that's most popular that we sell on the marketplace has a $900 deductible, and then the most you pay 10% in addition once that deductible's been met, and the most you could be billed is $5,200 for the year. So God forbid you had a quintuple bypass and 5-day hospitalization and cardiac rehab and all of those things. Afterwards, follow-up doctor visits, the most you could be billed would be $5,200, even if all those bills came to $120,000. So those indemnity plans and those Medicare Share plans or faith-based plans don't have that. And so you're buying a plan, especially with indemnity, and these people are really, really aggressive right now selling these things. So you're paid on a schedule of benefits. And the only way you're going to get real value as opposed to Obamacare is to take a skinny plan. In other words, a plan that might only offer you $1,000 a day in the hospital, might only pay $125 for an emergency room visit, might only pay $1,500 for chemo. Well, I got news for you. If you're in the hospital and need a lot of attention, $1,000 a day is not going to cut it. You may only get $500 or $1,000 for a surgery. You have to be careful with these plans. Again, what scares me the most and what I think that what really makes me nervous about them is the huge commissions they pay agents. Normally we get paid, probably around on average now we don't get paid at all on individual health insurance, mind you, right now. So when we do this, we're working for free. So understand that. Normally, if inside that 45-day window that they do pay us, we get $15 per month per person that we sell insurance to. So that can be 5% or even less commissions based on that. These indemnity plans pay agents up to 35% commissions, 35%. So there is major enticement for people to sell you these, even when they don't protect you. So we have an agent that worked here whose brother had bought one of these plans in West Virginia, because in West Virginia, insurance is even more expensive than in Pennsylvania. and somebody got really sick, they got $40,000 in bills. $40,000. Listen, as far as I'm concerned, there is no commission worth selling a plan that could possibly result in my clients being stuck with tens of thousands of dollars in bills, like due to a cancer diagnosis or other serious injury or illness. So listen, buyer beware. Now, there are others who may just decide this is an opportunity to opportune time to retire, since they're already 65 and eligible for Medicare, or they're not that far off. You're 61, you're 62, you're now eligible. At 62, you're now eligible for Social Security. So this may be say, you know what, I'm just going to retire. I'm going to collect my Social Security. Of course we can assist those who aren't yet 65, bridge that gap to Medicare and explain your options. And then obviously, if you're on Medicare, talk you through, if you're already 65, talk you through the process of going out and signing up for Medicare Parts A and or B. We can provide you with the forms you need and the directions you need to do that through Social Security. And then obviously advise you on what type of Medicare plan, supplement advantage plan may be best for you, which is super important. Again, those of you who are not familiar, basically you have two choices in Medicare plan. You have supplements and you have advantage plans. They work completely different from each other. So again, that is super, super important that you understand that. So if we can help you point you in the right direction as far as Medicare goes, as far as medical assistance, COBRA, an AC8 plan due to the loss of your job or reduced income, for those who are self-employed, please don't hesitate to reach out. It'll be our pleasure to assist. So everyone, again, please be smart and stay healthy. Give us a call if we can help you with anything, 724-603-3403. Visit us online at getyourbestplan.com, getyourbestplan.com. Thanks, everybody.